I'm Amy Mahaly from Be Well Clinic, and today I want to talk to you about calcium. This is actually one of the most amazing things that I have learned as I've been studying nutritional deficiencies and what's called deficiency disease, which is when you have a deficiency of vitamins or minerals, what symptoms show up in the body. Calcium is a major factor in a couple areas. The first would be the nervous system. The second would be the immune system. And then there's also, of course, like muscles, the heart muscle, getting growing pains and restless legs and leg cramps is about calcium and magnesium balance and other things. But minerals are so key to so many aspects, and calcium's right in the middle of those. Calcium is important for more than just growing strong bones and teeth, which is of course important as well. One of the things I want to talk about calcium today is really this calcium tissue action as opposed to what's stored in the bones and teeth. There are some correlations you can draw about that, but I want to focus today on what the tissues, so the muscle tissue and the nervous tissue, is doing when it has enough calcium or when it doesn't. Before we get into that, we need to talk about three things: calcium, vitamin D, and something called vitamin F, which we'll talk about a little more in a second. Calcium, of course, is the main player. This is an abundant mineral in our bodies, and there are a lot of sources of calcium. We all probably have heard that you will absorb calcium better if you have vitamin D. And let's talk about vitamin F. So vitamin F is the name for a compound that the liver makes from combining linoleic acid and alpha linoleic acid into a complex. This is called vitamin F, and you can even Google this. Vitamin F is really key in moving calcium into the tissue. So here's kind of the basics of how calcium, vitamin D, and vitamin F work. Vitamin D we think of as absorbing calcium, which is not incorrect, but more correct it would be to say that vitamin D moves calcium into the bloodstream. This means not only the supplements or the animal fat you ate or the cod liver oil you took, that vitamin D is really great for moving calcium into the bloodstream, but so does sun exposure. This will come in a little bit. So vitamin D in the bloodstream pulls calcium to it, and so then calcium ends up in the bloodstream, which is great. That's a good step, especially when we're absorbing it through our food. We need it to get into the bloodstream. But we actually require a second vitamin to move calcium from the bloodstream into the tissue, and that is a complex called vitamin F. So we actually need vitamin D and vitamin F to get the calcium all the way into the tissue where it needs to be. So I said that the sun comes into play here. That's because sun exposure makes our bodies produce more vitamin D. This is really great, except if you don't have enough vitamin F to balance the vitamin D that just increased in your body. If you have too much vitamin D, you're going to pull calcium from your tissue and not have enough F to put it back. This calcium tissue deficiency is going to leave you with symptoms like sunburning easily, restless legs, maybe leg cramps. If you're someone who can't be out in the sun very well, or you don't feel good, you don't sleep well, your legs kind of hurt or are restless after you've been in the sun all day, it's very likely you either are low in calcium or you're low in vitamin F to put calcium into the tissue. I like to explain this with the sun because this exact same thing actually can happen when we're sick. So one of the things that we have learned through different research, including some retroactive studies of patients admitted with pneumonia, they went back and looked at their labs and they found that calcium bicarbonate, which is specifically the calcium that the tissues use, was low in people who had negative outcomes. So either they didn't recover at all and they passed away at the hospital, or they took a long time to recover. The number one factor that was common between these thousands of patients that they studied was actually their calcium tissue levels. So if we don't have enough calcium in the tissue, we're going to have irritated muscles and nerves, sure, but we also have a lowered immune function. This comes in really interestingly when we look at different illnesses like shingles that people actually get more likely after sun exposure. This explains exactly what's happening. The vitamin D pulled the calcium out of the tissues were left open and vulnerable because they were deficient, and we didn't have enough F to put the calcium back into the tissue. What's really cool is the practical application we can have when we are ill. So if we have low calcium in our tissues are more likely to replicate viruses and bacteria. Our immune system is not going to be able to have as much an effect. partly because of the actual presence of calcium, but calcium also initiates phagocytosis, which are the eating white blood cells, which help to clean up our bodies. As illness is largely a detoxification process, it makes sense that calcium actually helps us not get sick or not be sick as long if we have enough of it in our tissues. So what can we do? There's a lot of things with this, and we actually talk about this in our blog post and our video. There's a blog post called What to Do Before, During, and After Illness on our website. I definitely recommend going and checking that out. I also have a video that I did a while back called The Health Illness Paradigm for Parents. And this is really looking at, instead of germ theory, kind of the terrain theory idea of what are illnesses actually. If we're not fighting off bugs and we're not trying to make our immune system stop invading attacks, but we're actually working with balancing the microbes, what does that mean practically in terms of caring for yourself or your sick child? Let me just give you a hint here on this calcium and vitamin F. So it's great to take cod liver oil when we are sick, especially we like the green pastures, fermented cod liver oil with the concentrated butter oil, which has K2 in it, which does seem to do some amount of mineral movement, including calcium. But if you are really good in your D and your calcium, but not in your F, that calcium can't get into the tissue where it needs to be. So a lot of times we recommend increasing vitamin F. There's a couple symptoms that might show you might be low in vitamin F. Some people will get vertical ridges in their nails. Other people have very consistent restless legs that don't get better with magnesium. Or you can have that easy sunburn, easy sun sick kind of symptoms. And that can be a tip-off. Definitely work with a practitioner for your particular needs. This is not a medical recommendation. We are just learning, right? Okay, so if you don't have enough calcium in the tissue, which means you don't have enough F to put the calcium into the tissue, we can eat more fat and support our liver to make more F. There are also some supplements that are a vitamin F supplement. Again, we use some standard processed ones. But what we need to do is get some way vitamin F so we can get calcium into the tissue. It is really cool what I see when that calcium gets into tissue. You have immediate relief of restless legs, if that is the problem of why you have restless legs. Your nervous system settles down. Your heart is a little more efficient and can beat a little more strongly, so you might have a little more energy, a little better oxygenation, and fevers come into play. This is the last thing I want to talk about in this video. Good job hanging in there. This is a complex subject, but I think it's so fascinating. So when the body needs calcium and there's not enough around, this can happen in illness, like we were just talking about, but it also can happen in teething. This to me was finally an explanation why we get teething fevers. If there's not enough calcium where it needs to be, the body can enact a fever to make calcium pull out of the bones. Think about when you got the bad flu and you had that bone aching fever. That bone aching fever is actually something that the body's pulling calcium out of the bones and the muscles, and often our kids are kind of twitchy and irritated as they're sleeping when they're sick or when they're teething. That is a low calcium in the tissue symptom. So if that's happening, maybe they just need more calcium. And again, our recommendation, if you can't get it from food, would be some calcium lactate. That works the most effectively in this situation. But you also may need vitamin F on top of it. And I just love talking about that because we need that piece. And if you need that piece, you need it. And you can take all the calcium you want and it won't help. And it actually can make you imbalanced in your minerals because you're overtaking calcium because you're not utilizing it properly. So one of the best symptoms that I see is when kids get calcium or calcium and vitamin F, depending on what their need is, oftentimes that fever will reduce within 15 minutes. That tells me that fever was actually to get calcium somewhere else, instead of a fever that was needed for the immune activity, which sometimes we need. I'm actually pro-fever, but a lot of times I've actually found that fevers are for calcium need, not for illness need. So this is a really fascinating topic. Definitely let me know what questions you have after you've watched this. I would love to do a part 2 if you want me to kind of go deeper into some areas because I know this is complex. And we didn't even touch how calcium is related to potassium, magnesium, the balance, what it does in the heart, right? So if you guys are interested in mineral videos, let me know and we can definitely dive into some more different topics. Please do like this video, share it with a friend, watch it a few times. Again, this is a lot of information. Let me know if there's anything that doesn't make sense. And if you liked this video, we have a ton more like this. So check out our channel, watch the different health topics or vitamin and mineral topics that we have there. Thanks again, and I will see you in the next video.